This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. Another beautiful day and cold. Whoa.
Well, we just went into winter, John. Come on.
That's right. So we'll try to warm you up here this morning on the show, as we do each and every Sunday. Health Watch here, 8 till 9, Talk Radio 1210 WPHT. What do we talk about here? Well, the key is in the title. We talk about health, specifically you and your family and anyone you know. And we do that with the one and only Dr. Molly Fantasia, as you heard the man say, the PhD doctor, executive director, and founder of Innovative Medical Associates. And we talk about here on this show with Dr. Molly all of the aspects at Innovative Medical and how they fit into the overall health picture. And certainly, if you have a question about what Dr. Molly does and what her doctors do as well, call into the show, 855-839-1210, 855-839-1210. That's the number here. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. Dr. Molly, it is always, we find it a bit of a challenge to explain to folks what you do. And on the initial consultation, people will say, I heard you on the radio, Dr. Molly, but what do you do?
Well, John, listen, you know what we do. It's so simple. It's
Right.
really very simple
It
concept.
is, yeah.
We all Innovative Medical Associates works out of my facility, which is in Marlton, and we are a licensed primary care facility. So what does that mean? Well, heck, if you come in and you need a Z-Pack, doc can write you a Z-Pack. If you come in and you need your blood pressure meds renewed, doc can give you the blood pressure meds. That's not really, though, the total focus. What we like to focus on is maintaining your quality of life regardless of what condition you have. And how do we do that? We do that through hydration and the delivery of what I like to call God's ingredients or natural ingredients, including vitamins, minerals, amino acids that might effectuate the change in your condition, certainly improve your quality of life, and reduce some of your meds. That is our ultimate goal.
Interesting. The other day, I'm sitting getting my drip, and a friend of mine calls me, and he said, where are you? I said, well, I'm at Dr. Molly's. I'm getting a drip. Well, what's that for?
And not drip coffee either, right?
So it's like, okay, what's that for? And I'm trying to explain it.
Well, today more than ever, how about
Immune
your
system,
immune
right,
system?
right, exactly.
John, it's amazing. It's amazing. Look, we're not going to tell you get rid of all of your medication. We're not going to do that. What we want to do, though, is to help effectuate the change for you and, if possible, reduce your medication so that we reduce the side effects that impede your quality of life.
Absolutely. Jim, I know we have a call. I didn't get the name.
Oh, wow.
Marty?
Marty. Okay.
Okay. Marty's in Cherry Hill. Marty, good morning.
Hi, Marty.
Welcome to Health Watch. You're on with Dr. Molly.
Good morning. Thank you for taking the call.
No
I'm just
problem.
Curious, do you have anything that can, I know it can't stop it, but can aid COPD?
Oh, my gosh, yes. Marty, please call and come in for the free consult. No, you're right. COPD can be is a chronic condition. Are you on some inhalers or anything, Marty, at this point?
Yes.
Okay, and how are your how's the lung function? I'm sure you've had the test, this kind of thing. How are you doing? How's your pulse ox?
It's been quite a while, but it's it depends on the day, obviously.
Sure,
but,
sure.
I'm able to. I'm still pretty active, but it's
good.
It's just a battle I fight, and I'd like to get some kind of improvement. If
Sure. Listen, I want you to read about vitamin C. I would like you to read about some other things that we do that I can't necessarily talk about over the radio, but I will happily talk to you about. But I can tell you that there are natural IV types of things that may help you and help certainly improve your quality of life, give you a little more stamina, keep your keep your oxygen level hopefully in a good range and let you be able to walk and walk around and work and those kinds of things. How old are you, Marty? Just a quick question.
72.
Baby, come in.
Yeah, he's
Come
a
in.
baby.
You're a baby. You're Dr. Molly's age. John and I share your age. So listen, you have a lot of life left. Let's get you enjoying life again. Please call and get the free consult. You're right around the corner. Okay, Marty.
I'll give you a call Monday. Thank you very
No
much.
worries.
Okay, Marty,
Thank you, Marty.
thank
That's
you,
a
and good
great
luck with
call.
that.
You know, that COPD is really an interesting condition because it impedes people's ability to really utilize their oxygen and get enough in. And I've done a lot of cases
I know
like
you have,
this.
yeah. That
all
I
the
know.
way. And I'll tell you something else. We should look at some of the same nutrients we use for viral, okay,
Right.
along with our particular protocol for that.
Right. So back to what we were talking about,
Sure.
and this is about, people understanding what you do and how
Yeah.
it can be helpful.
Yeah.
So my friend says, well, what I said, well, I get vitamin C. I said, and it really helps, especially today with the immune system and,
Yeah.
COVID-19. He goes, I didn't know you get that done. How long you been doing it? I said, 20 years. I didn't know that. Now, I've known him for 20 years.
Yeah, and
So it's like, wait, it's like a revelation or
right,
something.
Right. Well, who talks about this? It's not
Exactly,
like
yeah.
it's not like when you go out, you start chatting about where do I go on Tuesday afternoons. You
Right,
know,
right.
This isn't. But I got to tell you, it's really it becomes part of people's actual health protocol, and I think that's really important because we're all about your quality of life. And you mentioned vitamin C, but in your particular protocol, John, I use much more than that.
I know you do,
In
yeah.
particular, right now because of Corona.
Right.
That's what we are doing.
Right. And I've mentioned this to you, and I do feel it. Like you can feel certain things.
Right.
Like after the drip, like let's say Wednesday morning, because
Sure.
I go on Tuesday.
Sure.
You feel like as if it's kind of like fighting for you. You know what I mean?
Exactly. Your immune system gets, you know what this is like? It's like a tune-up in your car. Your immune system gets back in sync. What am I all about? Homeostasis. I want to bring you back in balance. And most of us don't stay that way. And it's not through our own fault. It's through all of what's happening in the world. Do you know how many people I hear every day with the anxiety of this coronavirus?
yeah.
And
I
what do
believe
you
it.
think that's doing to your immune system? Just thinking about it
Exactly.
the way we do.
It doesn't help. No.
It doesn't help. It doesn't.
And we're going to talk about that a little bit later on in the show.
Sure.
But I guess the question here is because we're talking about my
Yeah,
situation, and Marty mentioned COPD. You have over 600 protocols. So
Exactly.
chances are you have something
Right.
for a particular condition. So you treat a lot of different conditions.
We do. And what we try to do is we don't necessarily look at this as a treatment option. We look at this as a treatment that may help your treatment option. So, for example, we do a lot of cancer patients. That's a good one to think about.
Yes.
So we're doing the supportive care, and my job is to keep you going as technically sound as you can be. I want you to be fine-tuned no matter what treatment course you take in your cancer journey. I have people who do the chemo, who do the radiation, who do the immunotherapies, right? I have people who do that. You're sitting there, they tell you.
Right.
But my job is to keep them going through this. You know how many people don't make it through their chemo, not because the cancer killed them?
The chemo killed.
Right.
Right. Yeah.
Right.
Oh, absolutely.
So our job is to keep your body in great shape, keep your immune system up so that you're able to take whatever's thrown at you and get through it and come to the other side.
Yeah. I wanted to ask you because we've been talking about a variety of conditions.
Sure.
And a couple weeks ago, we started talking about ED, and
Oh,
one of your patients, and again, people they don't think about what you possibly have in your arsenal.
Right.
And one of your patients said to me, "Does Dr. Molly treat ED?" I said, "Yeah, she has a protocol for that."
Of course.
I said she has over 600 protocols, so chances are, whatever you have, it might be in there.
What
you know?
I find interesting is he came to me for another type of chronic condition that actually impedes his blood flow. So yeah, all these new things that are out, these physical therapy things that are out. And by the way, we're really putting together a full men's program right after the holidays. That'll knock your socks off, because if you don't have enough blood flow to sustain that erection, forget about it. Doesn't matter what fancy things you do.
Yeah, exactly right. We are coming up on our first break of the morning. Our show is Health Watch, and we're here every Sunday, 8 till 9, Talk Radio 1210. WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly, you have a medical challenge, you want to run by her, this is the perfect time to do it. 855-839-1210, the number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. We are back here on Health Watch. And as always, operators standing by at Innovative Medical Associates. And if you would like to call, and you've heard some people call, and Dr. Molly suggests they make an appointment, the initial consultation is complimentary. Remember that. 856-489-0505, 856-489-0505. You have a question, you want more information, they'll be happy to give that to you. And remember, the most important thing you can do is book an appointment with Dr. Molly. And again, the initial consultation is complimentary. And that's where you really find out, because invariably you'll go in there and say, okay, Dr. Molly, tell me, what do you really do? All right.
Actually, more than that, John, they can see what I really do. 'Cause
Exactly.
if you come in right, you get to talk to a lot of my patients. And
Right.
again, they're pretty articulate.
And if you come on Tuesday or Thursday, you can talk to me. There you
Exactly.
go. All right. InnovativeMedicalAssociates.com is the website, InnovativeMedicalAssociates.com. And remember, we have our Health Watch replay every Sunday, 4 until 5. It's this show replayed this afternoon, 4 until 5 here on Talk Radio 1210, WPHT. And we should mention to you that if you are going on Google and you're looking up Dr. Molly, you should put in Dr. Molly Fantasia, because we found out this week there's a
glitch.
A glitch, yes. So Dr. Molly Fantasia, put that in and you'll find out where and all of that stuff that you need to find out. Right now here on Health Watch, 855-839-1210 is the number in the studio. Question for Dr. Molly, 855-839-1210. And Dr. Molly, we're going to talk about a patient who I've seen her a few times. And, it really, it breaks your heart sometimes when you see a young person in a wheelchair.
Sure. Exactly. And she was in what they consider the wheelchair that breaks down into a stretcher.
Right.
You saw that.
Right, yes.
She needed to put her legs out. And great kid, Bella, and great parents. And they didn't give up. That's the thing. They didn't give up. She had gone to countless physicians. Most of the time they said it was in her head. Then they said it was her mother's fault. I mean, I went, and I've gone through this before. I had another case very similar to her. Also a young man who, by the way, is now graduated law school, so he's an attorney. And I think Bella's on her way also. She just started college here in South Jersey. Interestingly enough, she came to me, and, in the history, and they brought boxes of paperwork going to all these other physicians, and we went through the paperwork, etc. The only thing I could think of is somehow a post-Lyme syndrome. In other words, she had the tick bite. It was treated traditionally, but this girl ended up with all the neurodegenerative problems. One day her legs just gave out, and nobody could figure it out. She went through all the traditional testing. So they just told her, go home. We'll give her some things for pain and, homeschool her and this kind of thing. Bottom line, very tenacious mom who was a nurse. She did not accept that diagnosis. What we did was we started over from scratch. We looked at the Lyme test. We realized that was negative. We did some specialized testing and showed that she had something like a subset of Lyme's. So she didn't really have the total Lyme I would say bands that are usually show up, because it's not the Lyme tick bite itself. It's what the Lyme tick deposits afterwards. That's why they put you right away on the doxycycline, a traditional remedy. But in this case, it didn't help with the post-Lyme syndrome. So we've been treating Bella for well over a year. And the good news is she's now going to physical therapy. We've gotten her well enough that she gets out of the wheelchair. She's going to physical therapy, and she's been walking a whole way. With help, she's walking with help and with the walker. She couldn't even do that when she first came to me.
How about that?
And I will tell you, she's now in college. She's going 3 days a week in college, and she said she gets up and gets into a regular seat. That's a big deal, and then gets back into the wheelchair. And I got to tell you, when I look at her, beautiful kid, and I look at her and I just know we're going to get to the other end because she's working hard at PT. Because regardless, I have to give her nutrients that start the mechanism to fire in the muscles. You see.
Yeah.
So certain B vitamins, certain other things, certain amino acids, that kind of stuff. And we're following her closely.
How did she get? Is this because of the Lyme tick?
Post-Lyme.
This is the post-Lyme.
It's the neurodegenerative piece. So let me tell you, folks out there, you hear me say this. Don't take Lyme disease like, oh, well, I'll just, take the doxycycline and it's over. It may not be over. And if you don't get it in time, it's not going to be over, and it can be a lifetime of a challenge. I have another gentleman who's going on disability over it. He was a trainer. I mean, he was in such physical great shape. Now he's got all kinds
I've
of
seen
neuro.
This patient, yeah.
I referred him to a neurologist who's working with us, and he's doing better, but not anywhere near where I need him to be.
So in the course of your protocols, the nutrients are helping to make up what they lost from Lyme?
We're hoping. Right. What it does is it holds down the inflammation, and then on top of that, what we want to do is have the cells start to communicate in various systems so that we can get those systems back to homeostasis. The Goldilocks theory, just right.
Okay. Speaking of inflammation, I know you wanted to talk about B vitamins, and I asked you. I said, "Am I getting those?" You said, "Of course you are." It reduces inflammation.
It helps reduce inflammation.
And this is.
And there are other things. So I did want to talk about this because one of my patients gave me a periodical that actually talked about B vitamins, but this is very interesting. It turns out that there is a particular drug that was made from B vitamins. They changed an enzymatic conversion to some of the Bs that ultimately get to some of the Bs that I already give in God's ingredients. I mean, God makes the Bs we need. The question is, do you get them? But this is interesting. The drug itself costs approximately $350 to $375 to get. Guess what? My B vitamin drip doesn't cost that much, John.
Right.
Okay. And it does a good job because we don't need the extra in there, the binders, those kinds of things to get to what the B vitamins do. So yeah, what it does is it reduces homocysteine. This drug was approved by FDA to do that. Reduce homocysteine. Guess what? Come and see me and save $350.
Yeah.
Okay.
You've often talked about inflammation.
Yes.
Briefly, can you tell us just a couple of challenges where inflammation comes into play, and you need
a couple, too numerous to count.
Exactly. You take the rest of the show with
right.
that.
Too numerous to count. It's bad for cardiac conditions. It's bad for neuro conditions. Too much inflammation is not good. Inflammation can be good. You're in trauma, you have a cut, it's the inflammation that heals up the cuts and the trauma. Inflammation, you're stimulating inflammation when you have a broken bone. You need to have that bone come together and heal. But if there's a dysregulation in some of the pathways and you then go into overdrive, you're in deep trouble. Right.
So you've used vitamin C, and now you're talking about B vitamins.
And I like to say vitamin C is a cornerstone, but B also brings that cornerstone together.
Right.
And thereby we have a process by which we're able to help people. And again, we have to look at the types of vitamin B. In other words, we take into consideration anyone who has a dysregulation in the making the biologically active B vitamins. That's very important. So if a patient has that, we then change up the form of the B so that they can get this and help with the homocysteine and other inflammation markers.
All kinds of nuances, huh?
Yeah, I'm afraid so, John.
Okay.
It's not so easy.
Okay,
Right?
exactly. We are coming up on our halfway point. We're coming up on another break here on the show. Our program is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. And we always tell you every show, and we had Marty call early, and that's a good thing. You know, if you have a question, we do have some open lines. You can call Dr. Molly now, because if you wait till the end of the show, happens to us every week. 855-839-1210, 855-839-1210. When it happens, I mean, it's like we can't get to the calls, so because we're out of time. All right, 855-839-1210. It's Health Watch every Sunday, 8 till 9. Our live version here on Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's program after these words. Welcome back to Health Watch. Operator standing by right now at Innovative Medical Associates, and if you want to call and get more information, 856-489-0505, 856-489-0505. And we should mention that if you call the show, you call the radio station, and you don't want to come on the air, well, you can call the operators, and they'll be happy to talk to you and answer any question you have. 856-489-0505. Our website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that. And don't forget, if you miss anything this morning or you want to hear it again, somebody said to me one time, you know, it's amazing. I listened to both shows, and the things that I miss, I didn't realize what I missed things, and I see them, or I heard them on the replay. So that's what you do. You know, you listen to the replay, 4 to 5 every Sunday here on Talk Radio 1210 WPHT. Our show is Health Watch every Sunday, 8 till 9, right here, Talk Radio 1210 WPHT. Let's go to the phones. Lana's in Philadelphia. Lana, good morning. You're on Health Watch with Dr. Molly.
Good morning, both of you. Good morning.
Good morning, Lana. Hey, this is the famous Lucky's mom. Okay.
Yes,
How are you?
This
This is Lana RN.
Yeah.
Okay.
Yeah, Lana has a dog,
Yeah.
and the dog is so good.
Yeah,
You know,
he's a therapy dog.
He's a therapy
So he
dog.
comes in and
Right.
delivers
and
some therapy.
He just really just kind of sits there, and he's become part of her. And the other day he wasn't there.
Yeah, we
so
were
I said,
upset.
"Where's the dog?
Where's Lucky?
You know?" So
Patients look forward to him. All right.
Yes. Well, listen, I couldn't help but call in because, Dr. Molly, I had mentioned to you when I first came to you, I was pretty broken.
Yeah, I remember.
I was filled with inflammation, and that inflammation went from head to toe. And I wasn't living my best life.
Right.
And, you know, I had patches all over, lidocaine patches, and
I remember.
Motrin and Tylenol, and I don't take anything for pain now. Maybe once in a while I'll throw a
Sure.
patch on, but I don't look like a scarecrow anymore, you know.
Thank God.
And Dr. Molly, the energy that I have, I tell you, and John had mentioned, you know, the next day after treatment, you feel just wonderful. But I got to tell you, that was in the beginning.
Right.
But now the effects of your hydration therapy, and now you're starting with the cleansing, the NAD.
Yes.
And the things that are coming from my body, I shouldn't say on the radio. And
Hey, Lana, you know why I like working with you? First of all, let's be honest. You're a registered nurse, and you know I love registered nurses, and you know my nurses love you. And the thing is, it's because you're an educated patient. But the detox is a little rough, I admit. I admit that, but necessary in order for us to get to the next level. Yeah.
Yes. And honestly, I've tried these things on my own. You go to the holistic store and you get cleanses, but this is the real deal. And I am so, in fact, when we hang up, I'm going out for my walk. I'm going to church to fill myself up spiritually.
Good.
It's just all good.
Thank you for
I'm
this
so
call.
Grateful.
And thank you for this call because it means a lot to me coming from a healthcare provider.
yes,
Thank you, Lana.
And Lana, just one quick thing.
Yes.
I mean, no more footloose and fancy free. The other day, no husband, no dog. I mean, This has to. I mean, let's get back to normal, okay?
Yes, that speaks to what else is there at your clinic in Marlton, Dr. Molly. It's Dr. Molly's family, and when I walk in there,
right.
I see smiles, I see faces. Yes, I see like John. I see wherever I want to sit, the chairs, the recliners, everything. You want water, you want crackers, you want. But it's a family here, and we're all trying, because of your efforts, Dr. Molly, we're all trying to be our best selves. And I just thank you from the bottom of my heart.
And, and I'll tell you what, I just put it all in God's hands. But, Lana, I can't thank you enough for the call.
Lana, thank you
for
your husband,
the call. And Lucky, bring him next week.
Yes, right,
Thank
exactly.
you.
Like I said, that's
great.
Footloose and fancy free. She was by herself. I said, what is this?
She's feeling good.
Right.
All right, we have another call.
Yes,
John,
we do. Marvin in Winmore. Marvin, good morning.
Hi, Marvin.
You're on with Dr. Molly.
Enjoy your show. I had pretty severe insomnia. Came on about 3 months ago, and they're trying to help it, but haven't been successful. Even with sleeping pills, it hasn't helped much.
Hey, Marvin, how old are you? I just want to get a feel for how old you are right now.
85.
Okay, I want you to be real careful with the sleeping pills, okay? Real careful.
Stopped. I'm not taking them. I
Good
took them
man.
about 2 weeks or so. I stopped them, doctor. Yeah.
God bless you, because you don't need that. Listen, why don't you? Do you try to go to bed at the same time every day? Those kinds of.
I admit I don't, but I will. Yeah, I know. I realize
Try
you
that.
should do that.
How about the melatonin? Have you tried melatonin?
I tried that. I've taken 5 milligram,
Okay.
8 milligram, even up to 10 milligram, and it
Okay.
hasn't done much good.
All right. Maybe we need to add a few other things to that, and we can. I bet you anything your anxiety is very high, like everybody
the
else's.
doctor thought that too, but I don't think I'm depressed, doctor.
That's right. Right. I think it's anxiety, and God knows right now with Corona, everybody's anxious, particularly those of us who are over 65, like I am, and John and you. So believe me, we get it. I'll tell you, if you call the office, I'll give you a few other tips in terms of this, and we'll see if we can help you with that. Okay. And what I can't do, my wonderful nurse Barbara will. Okay. God bless you, sir. Thank
Marvin,
you, Marvin.
thank you. Good luck with that.
You know what? It hurts me to have somebody like him talk like this, because everybody's got anxiety over this corona.
Yeah, and to be clear, Dr. Molly, anxiety is not depression.
That
There's
is
two different things, right?
That's right. Two different brain mechanisms. They can be together, but lots of times the anxiety seems to be the overwhelming issue.
And sometimes you don't even know that, right?
That's right. Well, we're full of anxiety right now.
Oh,
Believe me.
Tell me about it, right?
Yeah.
All right, 855-839-1210. We wanted to talk about this particular patient you mentioned to me who lost 5 feet of his intestine.
Right.
And he said to you, this is his words, the nutrition that you're giving him has saved his life.
Exactly. Think about this. This poor guy lost a large section of his intestine, and it just was a mess. He was I would call him a medical mess when he came in. Discussed his case with Dr. Testa and my docs, and we just couldn't even believe the stories he was telling us. But the bottom line is he lost a lot of his intestine. Therefore, he lost most of the way by which he can get his nutrition and his vitamins and anything good that could come out of the food. He just can't eat. So you can imagine they were going to put another J tube in him, it was a mess. So I started him on a nutritional regimen of amino acids, as well as, which are proteins, as well as the vitamins and minerals, and zinc in particular for this gentleman, because men need it. He's a hardworking guy. He owned 5 pizza places. He was down to 1 because he had no energy to supervise or go, and his whole life was compromised. I have to tell you, I think he's up to 5 or 6 treatments. He came in this week and he said, I want to tell you, you helped save my life. I said, not me. The good Lord saved your life. But it just goes to show you the power of nutrition. The power of nutrition when delivered via hydration.
And that's been the key. You've always talked about hydration, and you heard Lana say, well, she goes
Right.
to the health food store and
Sure,
it doesn't.
sure.
Because it's just not enough,
Well,
right?
Right. Can you imagine, though, with a gentleman who doesn't have as much intestine as the rest of us? He can't even get a third of what he puts in his body. Even if we were getting a third when we swallow some of this, he can't even get that. So, I mean, this was a real, honest to goodness medical mess as well as nutritional mess. And I think that we're getting him on the road. Now, he's going to have a problem for the rest of his life. Don't misunderstand me. I mean, he's missing a vital part to, soak up his nutrition. So he knows he's going to be as he said, I'm going to be a lifer. Okay.
Well, obviously he's going to need that because
Right.
with
But
5
he's
feet
a
of
young
his
guy,
intestine
too.
gone,
and he's a young
right.
guy. He's only 50-ish.
Jeez.
Can you imagine? Terrible thing. Just terrible.
Yeah. And this is kind of like a common story, and I did want to, and we'll get into we got a couple other things to talk
Sure,
about after the
sure.
break, but we're seeing today on the show a common theme of people really feeling the effect of what you're doing.
Exactly.
And it's helping them.
Look, as I say to you, though, John, it's not holy water.
Right.
It takes some time.
Exactly.
Don't I wish I could wave a magic wand or a hose over you, and next thing you know, you're hydrated and you're great, right?
Right.
No, it doesn't work like that, especially when we have chronic conditions. But I can tell you that if people follow what we ask them to do, and with the good Lord's help, we get people to be fairly functional. In fact, better than fairly functional.
And with that, we're taking our final break of the morning here on Health Watch. The number in the studio, if you have a question, we still have time for a few more calls, 855-839-1210, 855-839-1210. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return, more Health Watch after these words. We are back here on Health Watch, and as always, operator standing by at Innovative Medical, 856-489-0505, 856-489-0505. That's the number. And they'll be there well after we leave you at 9 this morning, or if you want to call tomorrow, Tuesday, whenever, that's the number. Innovative Medical Associates, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget the Health Watch replay coming up this afternoon, 4 to 5, and every Sunday we do the same thing. So if you miss us in the morning, or if you want to hear it again, feel free to tune in 4 till 5 this afternoon here on Talk Radio 1210 WPHT. We have a few minutes left of the show. Still time to take one or two quick questions, 855-839-1210. We always like to talk about different situations, Dr. Molly, and it kind of helps people understand what you do. And you mentioned earlier depression, anxiety,
Right.
and you wanted to talk about this patient
Right.
who's had severe depression.
Right. He has severe depression. This guy, first of all, let's say how highly functional he is. He owns a restaurant. He owns properties. He's a really, really smart guy. Very smart. And here's the thing. He's been suffering from anxiety, and he has reasons to suffer from anxiety and depression. A lot of challenges within his family. But that being said, he's very smart. So what I did was I ran a particular test that actually looks at pharmaceuticals. So I'm not against pharmaceuticals.
Right,
When you
right.
need an antidepressant, you better get on it. Bottom line was, this particular test is a genomic test that looks at his gene sequencing and what actual major drugs within categories of antidepressant and anti-anxieties might work the best for him. Well, I was puzzled because guess what came back? It came back that the antidepressants that he's on actually can work for him. So now Dr. Molly had to put on her research hat and figure out what else was going on. Well, I stumbled across a very good study that talked about the gut-brain connection, which I believe in, and you've heard me speak about that here on our radio show. So they said supplementing these folks with certain probiotics as well as prebiotics may intensify their use of certain drugs that they're taking. So tomorrow I'm meeting with him, and I'm going to tell him I want to put him on a certain nutritional regimen to include these probiotics.
So this kind of helps.
Right.
It
helps the gut.
Back to
right.
what you talk about,
Right.
supplementing.
Supplementing. And in this case, I'm hoping that helps the patient.
Okay, we have John in Marlton. John, good morning.
Hi, John.
You're on Health Watch with Dr. Molly.
Hey, Dr. Molly.
Hey, my favorite
listening
patient.
to you, yeah, good morning. Yeah, listening to you this morning, and last week you were talking about the protocol for ED.
Right.
Well, that's got to help. It's got to help with the plaque and the blood flow.
Correct. That's right,
correct.
John.
Well, why wouldn't that also be good for the heart?
It's
why wouldn't that help?
Yes, John. This is why I love you. Okay, they say that barbers. Am I allowed to say that you're a barber? Barbers are small doctors.
Yeah.
In the old days, they called them doctors because they are smart guys,
well, they
right?
had the red, white, and blue, and they took it away from us.
That's right.
That's right. We were making.
That's right. But you can see because you're a researcher. Right.
Does that make sense, what I'm saying?
Absolutely.
Well, you cut your teeth on that in the beginning, remember?
Listen, this is exactly right. What's happening is all of my patients are flocking to these urologists who are doing all this, kinds of what they call fancy stuff. But the bottom line is, yes, I agree with what they're doing from the physical therapy point of view and utilizing the radio frequency. However, if they don't have enough blood flow to that area and they have plaquing in addition to the old blood vessels, let me tell you, it ain't going to work as well as it can with a combination therapy. You get ready, John. I have one in the works for January, and I agree with you.
I'm not worried about what.
No, not for you.
Break the plaque up for my heart.
You better believe it. You better believe it.
That would be very beneficial.
Exactly, and that's exactly right. And that's where we go. We want to work on the plaquing systemically from head to toe, and we can indeed do that. Thank you, John.
John, thanks for the call.
That was a great call.
You guys have a great day.
You too. That was a great call.
But in the beginning, remember when you first cut your teeth? I remember
EDTA, chelation therapy.
People had bypasses and were coming to you.
That's right.
Because the bypass didn't work.
Exactly.
And so this was done when you first started.
Exactly.
Like 24
but John's
years ago.
right on it.
Yeah.
We're worrying about quality of life issues, which we should be worried about. I'm all for the quality of life issues. But in this case, we also have to worry about systemic plaquing because you can be sure if we don't worry about the cardiac output, nothing else is going to matter.
Right, exactly.
Right.
We would be remiss if we didn't spend a few minutes on Corona.
Oh, my goodness. Corona.
Is there a specific protocol you have for prevention, or is it simply vitamin C?
Listen to me. No, we use various nutrients to strengthen the immune system, right, to work hard against all viruses, not just corona. So it's a series of amino acids, vitamin A, which really helps mucosal integrity, so the mucus in your chest, vitamin C, of course, vitamin D, vitamin E, and zinc. And my physician might just order a antibiotic along with that, depending on the symptoms that the patient has when they come in. But I must say something, John. You must strengthen your own immune system. I mean, we're going to be living with corona, it seems like. I almost feel like it's forever.
Hopefully the vaccine comes in April. That's what they said.
I don't know. But what I do know is we got to have a good immune system in order to survive any viral situation.
Besides your hydration protocols, is there anything else people can do?
People should go out and talk about getting these nutraceuticals that we know help in this case, including vitamin A, vitamin C, D. D's associated with the viral replication. It stops that. E, maintaining T cell health, which is the killer cells, and also amino acids, proteins to keep us going. So there's a lot of things people can do to help themselves.
And of course, come in and get the hydration.
Come in and
drips.
get hydration, not just vitamin C.
Yeah, I always feel like it's very, like I said, I feel it like working. It feels like I feel better on Wednesday than I do on Monday before I go in.
I can tell you one thing. if you maintain your immune system, you have a fighting chance with this corona, and that's the bottom line.
Absolutely.
Right?
Absolutely.
That's the bottom line.
And as you've mentioned, we're of a certain age that we have to be concerned about that.
Absolutely. I mean, this thing has turned into the Black Plague.
Yeah.
I mean, that's the bottom line, and it's consuming everybody. All the anxiety and depression I'm seeing, I'm sure, is all around this.
Well, guess what? We're out of time.
Oh, no, Jeff.
Yeah, we're out of time. That's going to put the wraps on another edition of Health Watch. And don't forget, operators are standing by, and they'll be happy to talk to you. You want to make an appointment with Dr. Molly, 856-489-0505, 856-489-0505. That's the number after 9 o'clock and tomorrow and all day today, whenever. That's the number, 856-489-0505. And don't forget, Health Watch replay this afternoon, 4 to 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, and our nurses, Jess and Crystal, and our medical assistant, Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, Health Watch, 8 till 9, Talk Radio 1210 WPHT. You take care.